This is an ultrasound image demonstrating an example of normal sonoanatomy of soft tissue and musculoskeletal layers. These tissue layers can be divided into superficial and deep portions. The superficial portion consists of the epidermis dermis and the subcutaneous tissue. The epidermis dermis will appear as a solid hyperechoic line of varying thickness at the very top of the screen. The subcutaneous tissue is relatively hypoechoic with intermittent lace-like strands. The deep portion consists of muscles, tendons, ligaments, bones, and joint spaces. Notice that the muscular fascia, which is this hyperechoic line here, separates the superficial from deep portion. Nerves and blood vessels will often run in this area. Muscle appears hyperechoic relative to subcutaneous tissue with striations that run parallel in a particular direction. Notice in this image that the striations are seen in the long axis as our probe is oriented in the same direction as the muscle. At the bottom of the image, we appreciate bone with a smooth hyperechoic line with posterior shadowing given its strong reflector. While this is just a single example of soft tissue, the general appearance of these layers on ultrasound are similar throughout the body, varying mostly in the thickness of the subcutaneous and muscular layers. It is important to be able to distinguish these layers, especially when pathology is present, to appropriately localize the abnormality and generate the correct differential diagnosis.